Hello, hello, everyone. Good afternoon. Welcome back to Thrive Alive. I am your host, Nurse Jazmine, and today we will be talking about mental health. We have a very special guest with us today, but before I introduce her, I am going to give you guys an icebreaker. So get your fingers ready, start typing. And the question is, what is mental health? What is mental health? Whatever it means to you, go ahead and drop it in the chat. And as you guys are answering, I am going to tell you guys a little bit about our special guest. Joining us today is Dr. Rachel Boutté. She is an assistant professor in the Department of Family and Preventive Medicine at Rush University Medical Center. She obtained her PhD in counseling psychology from Virginia Commonwealth University and her Master of Divinity from Memphis Theological Seminary. Dr. Boutté investigates the influence of socio-cultural and demographic factors on health outcomes. She examines the ways that systemic and interpersonal forms of discrimination shape attitudes and beliefs about engagement in health-promoting behaviors. Dr. Boutté was recently funded by the Chicago Chronic Condition Equity Network, aka SCENE, to develop and pilot an intervention to examine the influences of gendered racism on Black women's health behaviors. So, Dr. Rachel Boutté, I am so excited to have you as our very first guest. Thank you so much for joining us. And I am going to just throw the first question at you. Just jump right in. So, May was Mental Health Awareness Month. How would you define mental health?
Well, first, thank you for that very kind introduction. And I'm so glad to be here. I think this is awesome work that AFN is doing, and I'm glad to be a part of it. Mental health is a little tricky. Like, what is it? Because for me, mental health is just health. So I think that that distinction between mental and physical health is a bit arbitrary, and it's also not very helpful because it opens the door for things like stigma, and it makes things like insurance really complicated when it comes to care and access. So that's kind of like my soapbox answer. Mental health is just health. But if we think about what does it mean in relation to, say, mental illness, for example, then I would say mental health means having a connectedness. It means being able to navigate your environment and the things that life throws at you in an adaptive, healthy way. Basically, just being able to deal. We know life is going to present obstacles, and so having strong mental health means that when that happens, you have resources in your toolkit and you kind of know what to do.
I like that. Mental health is just health. I like that. Awesome. So, how does mental health connect directly to physical health? So you kind of answered that a little bit, but what is the integrated whole?
Yeah, it's, like I mentioned, it's sort of this arbitrary thing to try to separate mental health from physical health. If we think about it, all of us are existing in bodies and we have a brain and a mind. And that's one whole thing. There's no way to separate the two from one another. And so a lot of our experiences, even if we take something really simple, like if we think about pain, let's say you stub your toe or you touch a really hot pan, there's that little gap in time from when it happens to when you say, ow, or oh no, right? That's the connection, right? So this physiological experience, you touch something hot or you had a stimuli that caused pain, it takes some time for that information to travel to your brain and tell you, hey, this is pain, this is too hot. So everything that we do is both. It's kind of a both and I think you can also think of it like this continual relationship. So if we're having something happen with our mental health, let's say we're feeling really down, feeling depressed, I think that we know that's going to affect how we care for ourselves physically, right? When we're feeling down, it may be difficult even to get up and go from the couch to the kitchen.
Right.
Even that could be
Right.
hard. So something like exercise might feel extremely difficult during a time like that. So it affects how we care for ourselves. And at the same time, if we have something going on with our physical health, that affects our minds, right? I spent a lot of time working with patients who have different kinds of chronic illnesses. And a lot of the folks that I've worked with, they have no history of any mental health concerns. And so when I see them, maybe they've just had a stroke, or maybe they've got a new cancer diagnosis. So all of the sort of illness is happening in the body, but I'm seeing them because that affects our state of mind, whether it's pain, whether it's fatigue, or even just the knowledge like, hey, my life is going to be different now because of this physical problem.
Wow, that's really good, and I'm glad that you are working with people who have physical conditions, because I think as a society we always just think of it as two separate things, and the truth is it's all connected, like you said. So I'm really excited about your work and what you do, and just grateful for people like you. I just wanted to throw that out there before we continue. Okay, so next question. Oh, this is my favorite. Could you talk to us about your research and how it connects mental health, body image, and culture?
Sure. This also, the other question that reminds me, I think you had asked me to talk about an experience, my own experience with this connection, and I forgot about that. Should I do that now?
Sure.
It reminded me because it's related to that, like the connection between the mental and physical health. Yeah, when we were prepping for this, you'd kind of ask, like, okay, did I have any personal experience with the connection between these two things? And I thought, oh my gosh, every day. Right? Once you have this sort of frame, you can see how so many of your experiences are because of this relationship. But the one that most comes to mind for me happened, oh gosh, I guess almost 6 years ago now. But I was in the middle of graduate school, so not an easy time, a stressful time, the middle of my PhD program. And my mom had been diagnosed with early onset Alzheimer's, and she died.
I'm sorry.
Thank you. And so it was, there's no good time, of course, to lose a parent, but this was a really precarious time because I was like in the middle of my program. So I like had my master's, but I was approaching these comprehensive exams, which are like tests and writing papers and all these things. And it's a milestone that you have to pass in order to move forward. So when I found out, I was just prepping to take a little bit of time off from school. I was going to go to Memphis and spend time with her in hospice care. And then I get the call that she's died kind of abruptly. So of course, everything comes to a full stop. And I go home for a few weeks, and then I come back. I return to school, and I sort of tried to keep going, but I got stuck.
Yeah.
So I was kind of stuck in grief. And then as a person who had dealt with depression off and on, then that came on in addition to the grief. And it was at a point where I was like, I don't even know if I can keep going. I don't know if I can keep doing this. And I remember talking to my dad, and he was like, well, you're not going to come home. You're going to stay.
Right.
You're on a mission. You're there for a reason, and you're going to keep doing that. So I was like, okay, we have to figure this out. And so for me, one of the things that was very helpful was movement. It was activity. We have this phrase that we use in health psychology, behavioral activation. And it basically just means making yourself do something, standing up, even if it's just for 10 seconds.
Right.
And so that sort of making myself just go for a walk, stand up, leave the house, like that was actually the thing that sort of got me unstuck.
Yeah.
So it became very real for me in that time, like, okay, this like mind body thing, because my mind was not there. I just wasn't, I hadn't processed the grief fully. I'm like in the middle of this stressful graduate program. But moving my body, exercising, yoga, these different things like that's what helped me. I had a therapist too, But that didn't get me unstuck by itself. So it
Mm-hmm.
became very real, like how these two things are connected.
Wow. Thank you so much for sharing that.
Yeah.
And I'm sorry that you had to go through that. That is, losing anyone is, hard, but a
Yeah.
parent, especially going through an already stressful
Right.
time in your life. So thank you for sharing that.
Yeah.
Um, but I think um, movement, like you said, I, I had a similar experience when I was going through treatment. Just would say, you know what, Jazz, go outside, get some
Yeah.
sunlight, go for a walk.
Yes.
And I didn't even realize that I was helping myself until I was done walking. And
Yeah.
I'm like, wow, I feel better.
Yes.
So it really is, we, as healthcare professionals
Mhm.
and clinicians, we often stress how important movement is. It's not just because you should be a certain BMI. It really does help connect the mind and the body and help with total healing. So thank you so much for sharing
Yeah,
that.
absolutely.
Um, so, oh, your research.
Research,
Yes.
body image, culture.
So wait, let me say this before
Yeah.
you start. Um, we often, when we think of doctors, especially in the African American community, we think of your typical a primary care physician. We don't think about people like Dr. Boutté, who is conducting research. And another thing about us as African Americans, we're afraid of research. We're afraid of studies and being a part of them because of things that have happened in the past. So I am so glad that Dr. Boutté is here to share what she does in and for our community to help us get a better understanding and feel a little bit better about what research is and why it's important.
Thank you for saying that. Yes, it's. I think we should never bring up research without bringing up the harms, the
Mm-hmm.
wrongs, all of the unethical things that have gone on in many communities, especially the Black community. And so, yeah, there are not a ton of Black researchers. So we're kind of in a small group, and it's so important though. It's so critical to have our voices in the room
Mm-hmm.
and at the table in the space. So my research, and it's funny because it exactly demonstrates the point why it's important for us not only to be the ones doing the research but also to be involved. So my graduate school lab was primarily about eating and weight
Mm-hmm.
stuff. So we looked at eating disorders, we looked at weight loss interventions, that kind of thing. And this is a very well-known phenomenon, but Black women tend to lose less weight in weight loss interventions compared to all other groups. So Latinx women, white women, anyone else, Black women lose the least weight, but Black women also struggle the most with our weight. So it's like the definition of a health disparity. So I became very interested in this in graduate school, and it informed my doctoral dissertation project where I was looking at body image. I was trying to figure out if maybe body image was the sort of missing link. Is there something about that? Is that the reason? So I did all these focus groups and set up this whole thing thinking I was going to try and understand weight loss interventions. And what the participants ended up talking about was stress.
Mm.
And not just stress in general, they talked about racism related stress. They
Wow.
talked about showing up in places, their places of employment, for example, and experiencing like hair discrimination. They talked about the difficulty of facing racism and sexism at the same time. So that completely shifted my whole like life plan and trajectory. I was like, oh, I have to figure this out.
Right,
Like,
right,
this is
right.
what I need to spend my time doing. Because this is so important. And they also talked about the participants were all Black women. They basically said that all these other health problems and issues all come back to the same thing, that basically is just hard. It's hard to manage all these competing demands, and that there's not a space for Black women to feel safe, to feel valued, to feel seen, to feel heard, and that affects everything else: mental health, physical health, all the things. So what I now know, like from having studied this for several years, is that they were capturing this thing that is becoming increasingly studied, which is good. It's this idea called weathering, and it's kind of what it sounds like. It basically has to do with the toll that it takes on the body when we are constantly facing stress that does not go away. And so for Black women, for example, there's a lot of research that shows that this explains like the crisis in Black maternal health.
Okay.
This issue, it's basically that Black women's bodies are older than their age compared to white women. So there's a lot.
Wow.
Yeah.
I'm just trying to process. I'm sorry. I'm just trying to process everything that you just said. So let me make sure I'm understanding this correctly. So most of the participants, mostly Black women.
All Black women.
All Black women.
Yep.
There is a direct link between stress or racial stress and discrimination and body image.
Yes.
Okay. And the ability to lose weight.
Yes.
Okay. Wow.
Yes.
Wow, that's very interesting. I've never thought about that. And as a person who has struggled in the past with losing weight and how I feel about my body and all that, especially after treatment, I never connected the two.
I didn't either, Jazmine.
Wow, that's
I never did either. That's the thing, right? I set out to do like, body image, and we're trying to, and I never thought that it was going to turn into what it did about racism, and that just shifted everything. I was like, this is so much bigger than what I thought I was trying to understand. Now, having studied it for a longer period of time, it makes a lot of sense because it's almost like for Black women in particular, the body is like the scene of the crime, right? It's like that's, if you think about like comments that are racially motivated, because you're also a woman, a lot of it comes in the form of an appearance type comment. And so it's like this idea of gendered racism. And I mean, now we've got like the Crown Act, right? It's getting national attention. So this law essentially to protect people against hair discrimination.
That's the fact that that's even
right. Then we would need a law.
That's crazy.
Which speaks to like the magnitude of the problem.
Right, right.
That it's big enough that we need a law to protect people in their schools and in their workplaces. So yeah.
Wow.
It's
big. It's a big problem.
It's a big problem. It's a big problem. And it can be, I mean, I think, so when I looked at the data that I collected, it was a qualitative study. So it was these groups, I had like massive amounts of data, you code it, and then you make these models. I was so excited, and also I was so devastated. Because the outcome of the models was like, okay, so this is a problem, and then the next part of the problem was, well, how do Black women, how do we deal with it? And so the two ways that they dealt with it, no matter what they did, it was like a no-win situation. So they basically told me that, sometimes we just try to adapt, we try to fit in with like white culture, and we straighten our hair, we do all these different things just to try to like appease other people. But then we feel on the inside this conflict, this internal conflict. We feel like we can't be ourselves. And that feels very stressful. Or some people say, no, I'm not doing that. I'm staying true to myself. I'm going to wear my hair how I want. I'm going to show up the way that feels authentic for myself. But then they talked about the cost, especially women in corporate environments. They said they knew by doing that they were limiting their opportunities. And that felt really stressful as well. So it was like no matter what they did, they came to the same endpoint, which is even more stress. And this is how they're trying to cope with the stress. So now it's like my mission is to figure out, is there a way to equip Black women with tools to help to manage this, the realities of this situation? Right.
And the sad truth is, yes, we have the Crown Law, but the sad truth is, there's probably a lot more time left before we are, 100% accepted as our
Yes.
authentic selves. So I appreciate you addressing the issue and trying to find a solution,
Yeah.
because the solution is not to just adapt. You know
Yeah.
what I mean? Or the solution is not to be yourself and then
Right. Missed
accept the cost.
opportunities.
Yeah,
Yeah. Yeah.
that's very, very interesting and sad.
Yeah.
It makes me sad.
Yeah.
I think about going on job interviews, and I used to wear my hair like
Yeah.
yours, and I would brush it out,
Yeah.
brush it back into a
Yeah.
ponytail, and just really, really being focused on how I look.
Yes.
And it was like second nature to me. I didn't think,
Yes.
why am I doing this? I just thought this is what I have to do if I want to get
Absolutely.
this job.
And that's what we've been told, right? Like,
Mhm.
this is what professional looks like.
Mhm.
And it's
Mhm.
set by this Eurocentric standard. And that's what they talked about. It's like, okay, these are my choices. I have only
Right.
bad options.
Wow. That is amazing. I am wow. Thank you. So I think now is a good time to check the comments and see if you guys have any questions for Dr. Boutté. Let's see here. So Robinia said, this is her answer to the icebreaker. Mental health to me is just as important, if not more crucial, than physical health. So just like you said about connecting the two and it all being one thing. So, we have a question. CY Fields is asking, does poor mental health contribute to other chronic health conditions? You kind of answered that earlier, but I would like to hear you
Yeah,
elaborate a little bit more
that's
on that.
a great question. It's very hard to answer it um, completely, in the sense that we can't say that one thing causes the other. But what we do know, what we can say, is that there's a higher prevalence of mental health among people that are suffering from some kind of physical health problem. So the two things seem to go hand in hand, but it's like a chicken egg thing, right? It's very hard to say what came first.
Right,
Right. Like
right.
I was talking about earlier, if your mental health is not doing very well, then it might be hard to make it to a doctor's appointment. It might be hard to just engage in like health promoting behaviors that might protect you from chronic illnesses. At the same time, you could have been completely mentally healthy, and then now you've got something going on in your body, and that really just takes a toll on people.
Yeah.
So they're definitely connected, but it's hard to say if one thing always precedes the other.
Right, right.
Yeah.
That's good. That's good. Okay. Wow, you just blowing me out of the park here. I'm like really like just processing everything you're saying, and like you're just providing just different ways to think about things like that I've never thought about, the whole body image and the racial discrimination all being connected. I'm just like still I'm like 30 seconds ago because I'm still processing everything you're doing with your research. So next question, do your studies in divinity influence the way you do your behavioral health research? If so, how?
Good question. I think it's easier for me to think about how they influence my clinical work. So a lot of the things that I learned in seminary school, I use as a clinical psychologist.
Okay.
It's sort of like different ways of talking about some of the same things. So, for example, in seminary, we had to do like a 6-month chaplaincy residency. So you're like chaplain, a student chaplain in the hospital. And you do all kinds of things. But one of the things that we did is called a ministry of presence.
Mm-hmm.
And it's basically you're just sitting with someone. They're suffering,
Mm.
their loved one is in the emergency department, or maybe they, are the patient, and you go in, you introduce yourself, you assure them that you don't have to do any particular spiritual thing like
Mm-hmm.
pray or anything unless they want you to. And sometimes you just sit there quietly with the person. And so the sort of seminary theology standpoint on that was like, you are creating an opportunity for God's presence in the room.
I love that.
And so through that silence, like that's sort of God is the other entity that's present in the space. And so fast forward many years to my clinical fellowship here at Rush in the Cancer Center. That was often something we did too. We did not call it a ministry of presence, but this is something as a therapist that I do all the time. You sit with silence with the person. We call it creating space.
I love that.
Or leaving room. And so there's a lot of things like that kind of translated, like skills that I learned in that context that just showed up again with different language and kind of wearing a different outfit, but it's the same thing. I think with the research, it probably gets at what you mentioned earlier, like with the trust and everything. For me personally, since I identify as Christian, I make a strong effort to ensure that what I am doing, like in my professional roles, are aligned with my values. And so, because I know the history, I try to be very thoughtful about how I'm going to approach my research methods. So there's some methods that I think honor people less, and other methods that try to involve the community that you're hoping to help. So that's a place where I think it has an influence. And then also just the spending time in Black churches, growing up in them, and then spending time in them, like in seminary, you see a lot of health issues, and you do wonder, like, okay, this is a place for healing, and encountering God and all of that. So why is there this discrepancy in terms of physical health, mental health, which is sometimes shunned in spaces like that? So I think it motivates me to want to make sure to bring some of this information out into the spaces where I think, some of the people who need the information the most could benefit, but it's just not they're not naturally going to encounter this.
Wow. What is it called when you are just silent with someone again?
In seminary, we called it ministry of presence, but as a therapist, we kind of call it, you're creating room or making space.
So I love that because I feel like you get to a conversation with the person and you kind of allow them to start it. And I feel like that makes them more comfortable with you, especially when you're in your role as a clinician.
Yes.
People are, they're afraid, afraid to talk, afraid to share. So just giving them that space and opportunity, and you're just sitting there like, okay, it's just me and you, and we're just going to be quiet until whatever comes to your mind, And I'm sure you've had experiences like that where someone just kind of poured, poured it all out.
It's honestly, it's remarkable, and I used to say it all the time, especially when I worked on the inpatient side of the hospital, that I can go in the room as a complete stranger. And a lot of times in inpatient, the patient did not actually request to see a psychologist. So they were often surprised that I was there. So it was not always a welcome, like, it wasn't like a person, an outpatient, who's like, I want mental health treatment. And so I am signing up to see a psychologist. This is like a person with a medical illness, and a lot of times that person's treatment team thinks that they could benefit from seeing a psychologist. So that could be incredibly intrusive. The person might feel all kinds of ways because of the stigma around psychology and mental health. So a big part of my initial work was just to be disarming. Like, I know that you may or may not want me here. I also know you're going through a really difficult moment, possibly one of the worst moments of your entire life. And I just want to support you through that. And I was always amazed and really impressed with people's bravery that they would share so much of themselves with me, a complete stranger, after knowing me for about 3 minutes. And it felt to me like a sacred space.
Yes. Yes.
It's just to be able to, enter someone's life like that, and that they allowed me to do it was very,
Well, you know, some people, you never know if people have that space in their lives to talk. You know, some people just have everyone in their life is telling them what to do. You need to do this, you need to do that. And you come in and you're just here to listen. And that's just, it's so important. It goes back to the importance of having a healthy mind and relationships and stuff like that. So I just wanted to point out what you said about incorporating your personal faith into your work. I think that's amazing. I think that it makes you human to your patients. And I can just only imagine how wonderful the encounters are between you and your patients, because that's a lot of clinicians don't do that. You know, they kind of just separate. You know, this is work, but you're working with people.
Yeah, it's very you're kind to say that. I think sometimes those pieces can feel at odds, right? Because people are not signing up for a Christian psychologist. They're just wanting to see a psychologist, or in that case, not even wanting to see a psychologist. So it's one of those things. But I think if the patient brings it into the room, then I'm like, great. Like, this can be something that can be a strength. But I think for myself, I always know in my mind, like, okay, I think that I'm doing something that God called me to do. So whether or not I ever explicitly bring up faith in the clinical encounter, it's just kind of where I'm coming from, like, for myself.
That's awesome. I love that. Just gave me chills. Oh, okay. All right. So moving right along. So this is kind of a follow-up question, I would say. How does the Christian faith empower us to seek support for mental health? And if you could include any biblical scripture.
Sure. I was really struck my first year of my PhD program by how much overlap there was between psychological concepts and scripture. Because, at least in my understanding, as I was always taught, like, science and religion are kind of like at odds, sort of pitted against one another. And even now, to this day, people in my sort of clinical academic world will be like, why did you go to seminary? Like, what does that have to do with anything? I'm like, well, that's what I felt like I was supposed to do at that time. Like, that's what I felt God was calling me to do. So I did it. But I remember so clearly, like, sitting in classes and thinking, like, this is the same thing. It's like, again, it's wearing a different outfit, but it's the same idea. So, for example, you know, there's a scripture that tells us to take our thoughts captive and put them under the obedience of Christ. So much of clinical psychology is that, at least half of it. It's just, what are you thinking about? And our fancy clinical word is cognitive restructuring, but it's taking a look, what am I thinking about? And is there a way to modify it, to make it more adaptive? You know, I think about Paul saying, think on these things. If there's anything that's of a good report, if there's anything good in the world, like, focus on that. There's all the scriptures that tell us that we have a mind of Christ in us. So I think, for me, like, that's the most glaring connection, is that there's a lot of scripture that deals with our mind and our heart. And that is what psychology deals with.
Right.
It's
Right.
our mind and our heart. So our big psychology thing is essentially looking at your thoughts, your emotions, and your behaviors. And that is so much of what the biblical teachings are about. Like, what are you thinking? There's a scripture that says to guard your heart, right? Like, what are your emotions that you need to be observing these things? You need to be managing them. And of course, in the Christian faith, you'd be sort of giving them to Christ. This obviously is not a part of psychology, but the idea that what you think about influences what you do and how you feel, that is embedded in both things. So I think there's definitely like a biblical precedent for mental health treatment for that reason, because there's so much emphasis on thoughts. It's tough because I feel like historically the church has sort of viewed mental health care as something that is in opposition. And so I'm really outspoken about encouraging people that you can do both.
Right.
It is
right.
great to do both things. You can go to church, you can pray, you can speak with your ministry leaders, and you can also see a therapist. And there are even places that explicitly do Christian-based therapy. So that is an option. And then as well, there are people like me. I don't do Christian therapy, but I'm a therapist and I'm a Christian. So if my patient was to bring that into the room, then I would be happy to talk about the relationship between the two things and kind of how we can rely on our faith to help with our mental health. So
awesome. Wow. Sorry. So really quick, I'm going to check the chat for questions again, because since the last time I checked a few minutes ago, you just gave us so much to work with. So Robinia is asking, what's a great starting point to dealing with these shared issues, struggling with appearances, racial tensions based on our looks? So what's a good starting point on how to deal with those issues?
That's a really
good
question. Very difficult question. Let me think here. A good starting point. I think the first starting point, you already did it. You're on it. Is to acknowledge it. So that's kind of where we always start in psychology. It's very hard to make any changes of any kind about something that we're not aware of.
That's so true.
So that's like always step number one, is to recognize that there's something that is not quite the way you want it to be. So I think naming that and saying like, oh yeah, there's some discomfort here, or like maybe there's body dissatisfaction. Like this is something that I'm struggling with or having a problem with. And then, the real answer is like, that's what I'm trying to figure out with my research. So that grant that got funded, that is my question. What would be the best tools? Like, how do we equip people? So body dissatisfaction in general, we have a pretty good toolkit for dealing with that, but this is different.
Very different.
This is different, and that's why I'm trying to do research and understand it. But in general, body dissatisfaction, we think about lots of things, but one of the things we think about is like, what are we taking in content-wise? So something we'll often have people do is sort of assess like their social media feed, for example, or the television programs, or like the magazines. We exist in a world where we're bombarded with images.
Yes.
Ideal images, which is what body dissatisfaction is about in part. It's about a discrepancy between how we are and how we think we should be. And so one of the things we have people do is see if they can kind of turn down the volume and all those images of what we should be, because that's going in. We're receiving that content. And even if we don't own a TV or a cell phone or anything like that, which all of us do, but even if we didn't, if we just walk down the street, there's billboards.
Exactly.
So it's literally everywhere. So this is about the part that is in your control, like your own personal social media feed or the television programs you select. Is there a way to see, are there particular things that are what we will call triggering, right? So are there certain images of certain people that when you see that, it makes you feel really unhappy, really dissatisfied with yourself? Is there a way to watch less of that, see less of those images? That's one of the things that people do, kind of, that you could do on your own right now without, you don't need any special guidance to be able to do something like that. But I think this racial piece of it, the answer is like the field, we don't know. People are just now doing research on like race-related trauma, or really it's racism related trauma. What that means, how do we help people with it? How is it unique from just general trauma, things like that? So I think that the answer is going to probably be some type of combination of things that we generally do to treat body dissatisfaction, but also things that are specific to experiences of racism, sexism, discrimination across the board. And a lot of it is processing, which basically is a fancy way of saying, like, talking about your experience with someone that is trusted and saying, like, yeah, this happened and this is how I felt. So having someone, a space, whether it's a therapist or even just a friend, where you can go and say, like, yeah, this happened. Just felt a little ick, I don't even know why. I think that's the hard thing about this, like, racialized body dissatisfaction. Like you say, you never even necessarily thought about it in that way. I hadn't either. And when I did that initial research, I was like, wait. So I went back in my mind. I thought of so many experiences that I had that fit with what my participants were describing. I was like, I guess that was an experience like that. I have one that's coming to mind right now. I was I was in a grocery store. This was when I was living in Richmond, and I was shopping for produce, and this white woman, walks up to me, but kind of like hurriedly. She was like, oh my gosh. I was thinking like maybe I knew her from somewhere, or I didn't know. She was super excited. She was like, oh my gosh. So she walks up to me. At the time, my hair was quite short, but curly, and it was like bleach blonde.
That sounds cute. I'm getting ideas.
So that was how my hair looked at that time. And so she runs up to me. Oh my gosh. I'm like, oh yeah. She's like, your hair, it looks just like my dog. Just like my dog's hair.
Wow.
And I don't even remember now. I think she told me what kind of dog it was and whatever. And she also like touched my hair, without my permission. At the time, I was just like, okay. And I continued on, with my shopping experience. But I remember feeling bad.
Yeah.
Like I felt bad about my hair, and I felt bad about myself in that moment. Like, oh, my hair looks like a dog's hair. And that can't be good, right?
Right.
There's no way that that's a compliment, although she was excited when she told me about this. Well, I think about little things like that. Like, that's the kind of stuff that there's not research that addresses, like, okay, if we know Black women are going to have these experiences, then what would be the right thing to do to cope with something like that in that moment? Like, what could you do? What could I have done, whenever that was, to reduce the ick or the lasting? And you have to think, this is a population that has like this is happening all this, like, over years, right? So it accumulates. It's not just like a one-off. So then what do you do, right? If you've got someone that's had 100 experiences like this, how do we help that person, like, psychologically, to deal with the trauma and the experience of that, but then also in the future, how can they be equipped to feel empowered in that moment to say or do something that feels better than just walking away? Maybe that's what feels best. I don't know. But I think that's the work.
Wow.
It was a very, very long-winded answer.
No, it was great.
Probably not that
It was
helpful.
great. I loved it. So we are nearing the end, sadly. But I was wondering if you could take us through the 4-7-8 breathing exercise. By the way, this is going to be up on the website as our community resource, AliveFaithNetwork.org/resources. But Dr. Boutté is going to give us a quick Well, you know what I'm trying to say. She gonna show us how to do it.
We're gonna practice it. Okay.
Get ready.
So just a brief, like what this is and what the point of this is. Most people have probably heard of the fight or flight response that we have. And basically it's the body's way of responding to a threat in the environment. And so when we perceive some kind of threat, we get scared or anything like that, this system turns on the body. And when it turns on, a whole bunch of stuff happens. One of the things that happens is our breath, instead of being kind of deep and full, it gets really like shallow and quick, this quick sort of chest breaths. Our blood pressure goes up, pulse goes up, all kinds of things. Our memory systems and planning, that all turns way down. That's why we can't remember things that happen when we're stressed. So a lot of stuff happens, and the body does not like to stay in this state. The body likes to be in the opposite state, which is kind of our resting, normal state that we should be in. So we have this tool, which is amazing that this is even a thing that works. But it's basically, it's like a nervous system hack. So you do this breathing technique, and it actually resets that process. It will slow your breathing, your heart rate, blood pressure comes down. So it's a very powerful tool that we have. The sort of one that we generally teach is called 4-7-8 breathing, but you don't have to use those increments. That might not be appropriate for you. The ratio is more important. So you could do, 3, 6, 5 if you wanted to, but we'll do 4-7-8. So it's best if you kind of sit up straight, feet flat on the ground, you kind of wear your hands in like a sort of a comfortable position. And all we're gonna do is breathe in for the count of 4, then we're gonna hold for the count of 7, and then breathe out for the count of 8. So I'm gonna take Nurse Jazmine through it, and I'm gonna do the counting for you so you don't have to worry about counting. Okay, you ready?
I'm ready.
Okay.
Should I close my eyes?
I like to close my eyes when I do it, but you definitely don't have to, only if you feel comfortable.
Okay, all right, I'm close my eyes.
Okay, so we're gonna start with the breathing in. 1, 2, 3, 4, and holding. 3, 4, 5, 6, 7, and out for 8. 2, 3, 4, 5, 6, 7, 8. We're gonna go one more time. We're gonna breathe in for 4, 2, 3, 4, holding for 7, 2, 3, 4, 5, 6, 7, and out for 8. 3, 4, 5, 6, 7, 8.
Wow, I forgot where I was for a second.
So we like to, generally
good.
you want to do it at least 3 or 4 times, and it's good to practice it when you're not under stress.
Okay.
So you want to like set a daily practice, maybe in the morning or at night, just run through it. So that way, when you are in a stressful moment, it's at the ready. You don't want to be trying to remember how to do it when stress is around, because your memory is not going to be great in that moment. But if you have like an Apple Watch on, so you can actually watch your heart rate drop as you do this. It's amazing. It's a very powerful tool. And you can use it anytime. A lot of times people fall asleep if they keep going through it. So you can use it for that. Or just anytime there's a moment of stress or discomfort and you just feel like you need a little reset.
That was good.
Yeah. And I think there's a resource about it.
Yes. So we actually, this is what the resource looks like on the website. So it just takes you through how to do it, and then there's some more information on the back. This resource is free. So go and download it, fold it up, put it in your wallet, and start practicing. Thank you so much, Dr. Boutté, for joining us. This was great. Thank you so much. And you guys, join us. We will be having a 3rd episode next month. Details to come. Bye, guys.